Okay, this is my thread discussion for week 3. Today's date is June 20th, 2015, and I just got done watching The Doctor, starring my man William Hurt. Let me just say, fantastic job, Bill. He tore this movie up. Excellent movie. I've actually never seen it before, so I'm really glad that I watched it. So, out of all the choices, I have no regrets that I took the extra time to watch this one, because it really reminded me of some things that I've thought about before and I've considered, but it's thinking about something, discussing it, writing iTunes U discussions about it is one thing, but actually seeing it happening, and Hollywood does dramatize a couple of things, and they kind of, I think they went a little overboard with a couple of scenes, but there are some underlying elements that I think make sense, and if we're not careful, could actually happen in real life. So, but if I had to choose one theme for this movie, I would have to choose empathy. Empathy played a huge part in this movie, and it's something that we've talked about in class. My last video was about ethics, about knowing right and wrong, but this one is empathy is different because it's all about putting yourself in that patient's shoes. And I've been in the medical field for a while, and the truth is, you can't truly understand another person and their situation unless you've gone through the same pain that they've gone through, the same position, the same challenges. And as someone who's been in the military, I think that's another reason why when you're in the military, you get so close to the people who are like in your squad or in your unit, because they're going through exactly the same thing you're going through. That's how you can grow and become sort of like a little family. And you understand them and they understand you. And that's shown in this movie. And one thing that I liked is the character that William Hurt plays, Jack McKee. He is a surgeon. One of the top heart surgeons at this big hospital. And he's excellent in his field. Very good. There was the very first scene, he's doing surgery, and they're singing and dancing, and I love that, because it really does make you think about how things really are in the OR. And I can actually say this now because I've been in the OR for the last 3 months, and it can be just like that. You're singing and dancing, and you're doing surgery, but you can be kind of playful. The surgeon's talking to you like, yeah, cracking jokes. And that was one characteristic of Dr. McKee that I really was very believable to me, because he was kind of a jokester. He had that reputation of cracking jokes. And during that first surgery, they're being playful, singing around, and then things get serious, and it's like, whoa, now things are getting serious, doctor. If we got to do this, and you've only got like 2 minutes, 3 minutes, and this patient is going to die. What do you want to do? And Dr. McKee, like a boss, says, turn the music up. and they're going through, and he's sitting there like, oh, I got this. I got this. Oh, this is, how you doing? and he gets it done. He's got clamps in there, and I like the surge tech role. I totally knew what was going on when she was throwing him. He's like, oh, I need 4-O-Proline. I'm like, I know what that is. And so he goes through the case, saves the kid's life. I think he was a young guy, a younger male. And then at the end, when he's closing, it's like, all right, let's have some fun. Closing music, and then they're all singing and dancing, and it really did remind me of how it can be. Because in an OR, it can be super super serious, and then you're back to being playful again. So I like that. But the main character, Jack McKee, is a surgeon, and to be honest, even though he's a really good surgeon, he can be a bit of a jerk at times. He's known for cracking jokes, but he does so casually to the point of at times being inappropriate. And they show that when he's treating one of his patients. One of his patients, she had staples going down her sternum, going down her chest, and she was asking him a question. She was concerned about her husband, the way he would look at her, I imagine, and he wanted to know how long, if those staples, if those marks or scars would be visible. And Dr. McKee makes one of the most I've met a lot of surgeons. I can't imagine them being this inappropriate or rude. I'm probably wrong. Maybe I've just met really nice surgeons, but Dr. McKee turns around, he's laughing, and he says, just tell your husband that you're a Playboy model and you've got the staples to prove it. And the look on her face, just like she just puts her head down. And because who says that? So they make it apparent that in this story he's a bit of a jerk, and it's possible that that a lot of his peers don't even really like him for that note, because he's kind of a jerk. I mean, it's not true. I think at the very end he really realizes who the people in his corner are. But he doesn't see it. He didn't even notice that he hurt her feelings because his back was turned and he was too busy patting himself on the back for that joke. But he's a surgeon. He's also a family man, lives in a nice house with a wife and his son. But later in the movie, pretty early, he's been coughing. And he's with his wife in the car, and all of a sudden he starts coughing out blood, and this kind of goes to show about doctors. I don't know if anyone's heard that saying about doctors being horrible patients. They're the worst patients. And I think that really kind of plays in here, because for a while he went into the doctors like, oh, it's no big deal. And it's like, why are you even here? Oh, because, I have a wife who's married to a surgeon. He thinks he's too good to be seen. He thinks he can take care of it himself. He's a heart doctor, but he thinks, oh, well, I've got a cough. I'm fine. I'll just drink some orange juice. I'll be all right. My wife, whatever. So he doesn't take it seriously. Even when he's checked in, it still hasn't dawned on him that this could be serious. I mean, you cough up blood, it could be pretty serious, but he doesn't want to take it seriously. And he sort of goes through those stages when you know that you're gonna die. He gets angry. He goes into the denial. He even starts bargaining. Well, I don't really think he starts bargaining. I really only remember the first 2 stages where, when he finds out that he has a tumor, he gets really angry. The first person he takes it out on is his wife. And then he's sort of in denial because he's trying to find out information about his file. In his file, he's calling over, trying to throw his weight around.